People go on about natural childbirth as if it were a disease rather than a natural event. One weekend on call as a family doctor, I received an urgent summons to attend a woman who was having her baby at home. At the last minute, the child decided to enter the world feet first, rather than diving out as usual. This had freaked out the midwives, which in turn had freaked out the mother. The baby had then shown its displeasure by pooping green slime, which is what babies do before they're in a position to yell. The mother had already been prepared with the vulva shaved and swabbed with antiseptic. I calmly instructed her to wait for the next contraction. When it came, I told her to quickly take 3 deep breaths, breathe in, hold it, and bear down firmly for as long as possible. Then, in the few minutes between contractions, I told her to take a complete rest. I told her to close her eyes, imagine herself lazing somewhere she liked or had dreamed about, and let herself go completely limp. By so doing, it was possible for all the muscles to relax and allow oxygen to pass freely, not only through the placenta and umbilical cord to the child, but also to the uterus itself, so that it was in the best possible condition to exploit the next contraction. After several contractions, a healthy boy that was pink to the very tips of its fingers was born. He was alert, started breathing spontaneously, and opened his eyes. People quarrel about natural childbirth, but this was natural childbirth. The mother laboured when nature said labour, and rested when nature said rest. I had never before seen a 7-pound newborn in such perfect condition. Earlier in my career, as a student, as an intern in Canada, and as a senior house officer at St Stephen's in Chelsea, I had never been impressed by what passed for a healthy baby. They were always blue round the edges, having suffered a degree of oxygen lack during birth, and this did not seem to me what nature intended. They had all been delivered by protocols that had originated decades ago, when maternal malnutrition and pelvic deformity was rife, and antenatal care non-existent. This used to cause countless problems during birth, sometimes even death for women in labour. Mothers were therefore always placed in what is called the lithotomy position, which made clinical intervention easier if necessary. This is what it looked like. A tent of sterile drapes preserved maternal modesty. Notice that the bed stops short so that it looks as if the baby might drop onto the floor. If I was a mother, this would cause apprehension, making it difficult to push hard and relax between contractions. Notice that the bed is narrow. If I was a mother, this would make me apprehensive about falling off and making it difficult to push hard and relax between contractions. Notice the feet are held in stirrups in an undignified position, making it difficult to wriggle or relax properly between contractions. Little wonder that babies born in such circumstances suffer oxygen deprivation and tinged blue. If the labour is long, the failure of the uterus to recover properly between contractions causes it to tire and become dysfunctional. This then necessitates caesarean section. This danger is likely to be increased if the partner is present, thus distracting the mother from putting her mind to the job in hand. Think about it, girls.